Hello, and welcome to the Living with ALS webinar series. I am Lori McFerrin with the ALS Association. Welcome back to those who have joined us previously. And for those who might be joining us for the first time, I want to share just a couple of housekeeping items. Our monthly Living with ALS webinar series is recorded, and the slides and recording will be added to our website over the next couple of days. We have opened the Q&A and chat features, so you can enter your questions at any time during the presentation. We will hold all the questions until Emily is done with her presentation. At that time, we also will allow folks to raise their hands to ask questions if you prefer to ask questions verbally as opposed to typing them in. We also ask that you stick around and answer a really quick 3-question survey at the end of the webinar. Your responses help us plan future educational programs that you want to hear, and it also lets us know how we did in providing today's presentation. I have a special request of folks. If you are looking for specific feedback on a question when you're responding to a survey, I'm happy to respond to you if you include your email address. We have no way of knowing. They're anonymous responses. So if you're looking for something specific, be sure to include your email address and I'll get back to you personally. So I think that's the housekeeping items. We're ready to introduce today's presenter. Emily Brown joins us from the Patient Advocate Foundation to address all things Medicare related. Emily, you've been here before, but we continue to have questions. Medicare is a pretty complicated topic. So I want to welcome you back. Thanks for being here.
Thank you so much, Lori. I appreciate the invitation. We're glad to be talking to the ALS Association today. So as Lori mentioned, my name is Emily Brown. I'm the Patient Education Content and Project Manager with Patient Advocate Foundation. I've been with PAF for over 11 years, and I'm, again, just pleased to be speaking with you on the topic of understanding your Medicare benefit. A brief history of PAF. Patient Advocate Foundation started in 1996 with a volunteer staff of 2 and served 150 patients our first year of operation. Now cut to 28 years later, we have a full-time staff of over 220 employees, and we have directly assisted over 2 million patients. Our foundation was started by Nancy Davenport Ennis and her husband, Jack Ennis, in honor of their dear friend and breast cancer patient, Cheryl Grimmel. They were inspired to advocate for patients after Cheryl experienced hurdle after hurdle while trying to access care for her breast cancer in the 1990s. And after getting halfway through treatment, only to find out the procedure she was waiting for was not covered by her insurance. Nancy and Jack knew that they did not want another patient to have to go through what Cheryl experienced, fighting for her life while simultaneously fighting her insurance company. So on the night of Cheryl's funeral, they wrote the business plan for Patient Advocate Foundation. And just a quick breakdown of our different service areas and the services that we provide to patients. We assist in a multitude of ways. Our case management services are provided at no cost to the patient or the point of contact reaching out to us. Patients may have any insurance status, any gender, any ethnicity, any age, cultural heritage, or any employment status. You can live anywhere in the U.S. or in any U.S. territory, have any income range, including no income, and be diagnosed with or screening for a broad range of diseases and diagnoses. So last year alone, we served patients with almost 1,000 different diagnoses. Our copay relief program assists patients with diagnosis-specific funding to pay for copayments. Some funds also will assist with medical insurance premiums. Our financial aid funds administer small grants directly to patients to help with non-medical expenses like transportation, food, and housing. That's also diagnosis-based assistance. Our education initiatives provide actionable advice and guidance to patients, caregivers, and healthcare professionals with a range of topics in a variety of formats. We have webinars, interactive trainings, written publications, podcasts, animations, and more. Now, we also offer a Scholarship for Survivors program that grants scholarships to patients who've been treated for a life-threatening diagnosis within the last 5 years. And undergraduate and graduate students are eligible to apply for that program. So during today's presentation, we're going to be discussing the foundations of Medicare, including original Medicare, supplements, and Medicare Advantage plans. We'll go into some comparisons and pros and cons of those plans. We'll discuss special Medicare considerations for ALS patients, and we'll talk a little bit more about where you can find help with enrollment, and we'll end with some PAF resources that you can access for more information. Medicare is a federal health insurance program. It began in 1965. It's overseen by CMS, which is the Centers for Medicare and Medicaid Services. It's a department of the Health and Human Services. It insures people 65 or older, people younger than 65 that have been deemed disabled, people with end-stage renal disease who require dialysis or transplant, and people with ALS that have been deemed disabled. Medicare is paid through 2 trust fund accounts with the U.S. Treasury that are only used for Medicare. The funds are acquired by different sources, including employer and employee payroll taxes, income taxes on Social Security benefits, premiums paid by Medicare beneficiaries, and funds authorized by Congress. So we talk about Medicare as if it is one thing. You hear people just say Medicare in general, but it's actually many different things. So Medicare is broken up into different parts of coverage, including hospital, medical, and prescription coverage. The parts are labeled as A, B, D, and C, which we'll go through all these. You may hear the term original Medicare, and that includes Medicare Part A and B only. So let's briefly touch on eligibility, and then we'll go into the specifics of Medicare and the different parts and pieces. So as mentioned on the last slide, people with ALS who have been deemed disabled are eligible for Medicare. So what does that mean? It's really hard to discuss Medicare for people with ALS without first talking about Social Security disability. Insurability for people with ALS who have been deemed disabled essentially means that you have been approved to receive Social Security disability benefits. Social Security disability acts as an economic safety net for people who are unable to work or have lost the ability to do so due to an injury or a severe illness. Disability helps folks pay for their household expenses simply based on their inability to work. So Social Security Administration administers 2 separate and unique disability programs. Social Security is similar to Medicare in that we discuss it as if it is one thing. However, as I mentioned, it's 2 very distinct programs. The first is SSI, which is Supplemental Security Income, and that is for low-income persons who may not have paid into Social Security or who may have had a more inconsistent work history. The second program is SSDI, and that's designed for people who have worked and paid FICA taxes into the Social Security Trust Fund system for years before becoming disabled. So generally, you need to have worked at least 5 out of the last 10 years before you become disabled and eligible in order to be eligible for SSDI. Normally, there is a waiting period for recipients of SSDI to start receiving benefits once they're approved. And there's also a 24-month waiting period for Medicare benefits to begin after you start receiving benefit payments. However, the ALS Disability Insurance Access Act of 2019 eliminated the 5-month waiting period for people with ALS who were approved for SSDI on or after July 23rd, 2020. So thanks to that legislation, once your disability application is approved, you can start receiving your SSDI benefits with no wait. And along with the ALS Disability Insurance Access Act of 2019, that eliminated that 5-month waiting period, it also eliminated the 2-year waiting period for Medicare. So this means once you're approved for SSDI benefits, you are enrolled into Medicare. And it can take a few months for patients to be approved by Medicare and start, receiving their information and documentation of coverage, their Medicare card in the mail and all that. There are many ways that you can get Medicare coverage, but the 2 main ways we're going to talk about today are via Original Medicare and a Medicare Advantage plan. Original Medicare includes Parts A and B, and it's set up so that you receive your benefits right from the government. So Part A covers inpatient hospital, skilled nursing home care, hospice, and some home health care services. Part B covers outpatient expenses like doctor's visits, lab tests, home health care services, durable medical equipment, as well as some hospital outpatient care services. Original Medicare has no networks, so you can go to any healthcare provider and get care as long as they accept Medicare payments. Part D drug plans are benefits that are offered by private insurance companies. They must provide the minimum coverage of benefits required by Medicare, and Part D plans are separate, so they have to be purchased in addition to Original Medicare. Medicare Advantage plans, sometimes also called Medicare Part C, these plans offer benefits through private insurance companies that bundle the parts of Medicare. So you can kind of understand why I explain those out of order. So they bundle most of the time A, B, and D together. Those plans have to cover as much as what Original Medicare covers. And the government still sets the rules and guidelines for those plans, but private insurance companies can sell and administer those plans. So like I mentioned, a lot of those plans do also come with drug coverage, so they have Part D in as well. To be eligible to enroll in a Medicare Advantage plan, you have to have Part A and Part B, and you have to live in the service area of that plan. Medicare is individual insurance, so spouses or dependents cannot be on the same Medicare plan together. So if more than one family member or person in a family has Medicare or is eligible for Medicare, each person is responsible for their own monthly premium, deductibles, co-payments. That's true for both Original Medicare and Medicare Advantage plans, as well as Part D plans. And there's no discounts or anything like that for married couples enrolling in the same plans. Medicare Part A, as we just discussed, covers hospital stays, skilled nursing facility care for the first 100 days, hospice, and some home health care services. Medicare Part A can be premium free if you or your spouse paid Medicare taxes for a certain amount of time while you were working. Most people don't pay a Part A premium because they paid Medicare taxes while they were employed. If you did not pay Medicare taxes while you were working, you most likely don't qualify for premium Part A, premium free Part A, excuse me. And the amount that you'll pay each month for your premium is based on how long you paid into Medicare taxes. It's actually rare to have a premium for Medicare Part A. About 99% of beneficiaries do not have to pay a Part A premium since they have had at least 40 quarters of Medicare covered employment. Medicare Part B is that other part of Original Medicare. It covers outpatient care, certain doctors' visits and tests, home health care services, durable medical equipment and supplies, preventative services, and certain outpatient prescription drugs under limited certain conditions. For the most part, if you receive preventative services from a Medicare provider, you will not pay anything out of pocket. With Medicare Part A and B, you're responsible for a yearly deductible, and usually you'll pay a 20% coinsurance for approved services that you receive. And there is no out of pocket maximum, so no yearly limit on what you'll pay out of pocket for services. Just a quick reminder, deductible is the amount that you must pay for healthcare services before your insurance company kicks in. And coinsurance is the percentage of the amount that you share for covered services with your plan. Your premium amount for Part B is going to be based on your modified adjusted gross income for your IRS tax return from 2 years ago. So for example, your 2023 tax return will be used to determine your 2025 Part B premium. Most people pay the standard Part B premium rate, but if your past tax return is over the established limit, you may have to pay an extra charge to your premium called an income-related monthly adjustment amount. That limit, as well as the standard premium, is reviewed and adjusted annually. So for 2024, the monthly premium is $174.70. Part D provides coverage for prescription drugs. There are specific Medicare approved plans that are private that you can choose to enroll in for your prescription coverage. Each plan differs in what they are covering and the cost that they're charging for prescriptions. However, Medicare has to approve all of the drug lists and everything. So no matter what plan you purchase, you're going to have a minimum amount of coverage that Medicare has set. The premiums for the plans depend on what plan you choose. And to enroll in Part D, you have to have Medicare Part A and or Part B. So Part D plans use formularies, also called drug lists, in an effort to help categorize and explain how the coverage works. They categorize medications and they structure the prescription benefits on these formularies. All the medications fall onto a tier, and the tier that the medication falls on corresponds with the cost of the medication. So everyone with Medicare, regardless of income or health status or prescription drug use, has access to enroll in Part D. And if you don't have any other drug coverage when you enroll in Medicare, you should probably purchase a Part D plan, even if you aren't currently taking any prescription drugs. So Medicare Advantage plans are considered all-in-one or bundled plans. And as I've mentioned, this is often an alternative to original Medicare that is attractive to some people. The Advantage plans include Part A, Part B, and usually Part D, all in one plan, and they're offered again by Medicare-approved private insurance companies. The plans still have to follow all of Medicare's coverage rules, but sometimes Advantage plans go over and above, and they offer extra benefits that are not normally covered under original Medicare. Sometimes that means vision benefits, hearing, dental, transportation, over-the-counter medications, and services that promote health and wellness, like gym memberships and that kind of thing. With these plans, you're still actually in the Medicare program, so you still are protected by Medicare rights and protections for patients. These plans can also offer customized benefits to people with specific conditions who are chronically ill. Out-of-pocket costs, including your monthly premium, can vary between Medicare Advantage plans, and Medicare will pay a fixed amount to your Advantage plan monthly to subsidize your care. Advantage plans also have a yearly limit on your out-of-pocket costs for services, and once you've met that limit, services are covered at 100%. Your out-of-pocket costs may be lower with an Advantage plan versus original Medicare. The type of Advantage plan you choose can also affect how you receive services. You may need referrals to see these specialists, or you may need to use specific providers or facilities included in that plan's network. With an Advantage plan, you do not need to and are unable to enroll in a Medigap plan, which we'll discuss in a bit. Usually, most Medicare Advantage plans include prescription drug coverage. However, if you are enrolled in a Medicare Advantage plan that does not have prescription drug coverage, you can enroll in a separate Part D plan. But if you enroll in a separate Part D plan while you have prescription drug coverage, you'll be disenrolled through both the drug coverage and the Medicare Advantage plan and placed back into original Medicare. And you will not have the same plan options wherever you are. The plans vary by the area that you live in. And just like regular commercial health insurance plans, they all have different networks of doctors and different covered services and medications within each plan. So Medicare supplement insurance, also known as Medigap plans, they help cover remaining healthcare costs after you have original Medicare pay. So like co-payments, co-insurance, deductibles. To enroll in a Medigap plan, you have to have Medicare Part A and B. Medigap plans are different from Medicare Advantage plans, and it's actually illegal for someone to try to sell you a Medigap plan if you're enrolled in a Medicare Advantage plan. Your monthly premium for a Medigap policy is going to vary depending on the type of policy that you choose. So some Medigap plans also cover services that original Medicare does not. Like if you travel outside the US, they sometimes will cover medical care in those circumstances. When you have a Medigap plan, Medicare will pay its share of the Medicare approved services, and then your Medigap plan pays its share. There are limits to when you can purchase these plans, as they're subject to exclusions for pre-existing conditions. So it's best to sign up when you're first eligible for Medicare, because at that point they're guaranteed issue, and there won't be any kind of screening or anything like that. So there's more information on the Medicare website about when you can and cannot purchase a Medigap plan. And I encourage you to review that if you're interested in this, because there's kind of a lot of sticky rules sometimes. This chart provides a good visual of the different parts of Medicare and what's covered under each part. You're going to have access to these slides, so I'm not going to spend a lot of time on this particular one, but it is good for a quick reference. And I just wanted to touch on this. If you or your spouse are still employed, Medicare operates a little differently. And whether or not you need to sign up for Medicare when you turn 65 depends on a couple of different factors. It depends how you get your health insurance now and the number of employees that are employed by the company where you or your spouse work. So typically, if you have job-based health insurance through your or your spouse's current job, you do not have to sign up for Medicare while you or your spouse are still working. You can wait to sign up until you or your spouse stop working, or if you lose that health insurance, kind of whichever comes first. If you're still working and you plan to keep your employer's group health coverage, it's just really a good practice to speak with your human resources department or the benefits administrator for your plan so they can walk you through when is the best time to enroll in Part B. And there are some additional special rules when it comes to Medicare eligibility. You can enroll in Part B without buying Part A, but if you purchase Part A, you have to also purchase Part B. You are eligible to enroll in Part D if you have either A or B, and you can't enroll in a Medicare Advantage plan or purchase a Medigap policy unless you're enrolled in both Medicare A and B. So if you are not enrolling in Medicare based on Social Security disability, you have a 7-month initial enrollment period to sign up for Part A and or Part B. The initial enrollment period begins 3 months before you turn 65 and ends 3 months after you turn 65. During this initial enrollment period, you have the option to enroll into Original Medicare with or without Part D or a Medicare Advantage plan. If you're under 65 and newly eligible for Medicare due to a disability, you also have a 7-month initial enrollment period where you can choose your Medicare coverage. This begins 3 months before the 25th month of receiving Social Security benefits and ends 3 months after your 25th month of receiving benefits. I know, like as we discussed, this is different for patients with ALS, but I did just want to discuss how the program typically works. If you enroll in coverage during the first 3 months of your initial enrollment period, your coverage begins the first day of the month that you turn 65. Yearly open enrollment period is normally from October 15th to December 7th. And this enrollment period allows you to make changes to your existing Medicare coverage. This is an opportunity for you to review your current plan to see if there may be better option or maybe a new plan that has additional features that you could utilize. Any changes that you make to your Medicare coverage during this enrollment period become effective January 1st of the following year. So during this enrollment period, you can change from Original Medicare to an Advantage plan, change back to Original Medicare from an Advantage plan, change your Medicare Advantage plan to a different Advantage plan, join or switch a Part D plan, or drop your Medicare coverage altogether. There are some special circumstances that allow you to enroll under a special enrollment period. In order to be given a special enrollment period, you have to meet certain guidelines. So if you didn't join Medicare Part A or B during your initial enrollment period, due to having employer-sponsored coverage through either yourself or your spouse, you will qualify for a special enrollment period when you decide to enroll in Medicare. You can use your special enrollment period to enroll in Original Medicare anytime while you're covered under an employer-based insurance or during an 8-month period that you have once your employer coverage ends. So there are other reasons that you may be eligible for a special enrollment period, such as a recent move, and you'll be able to switch to a new Medicare Advantage plan or prescription drug coverage if you are in that circumstance. Some other possible circumstances that would make you eligible for a special enrollment period would be losing your current health coverage, if your current plan changes its contract with Medicare, or if you receive some type of notice of an error from Medicare or from your plan. Timeframe for a special enrollment period and the effective date of your new coverage varies depending on the circumstance that qualified you for a special enrollment period. There are other enrollment periods for Medicare throughout the year for very specific circumstances. I'm not going to go deep into those today just for the sake of time. But the Medicare website is a very good resource if you are interested in learning more about other times of the year where you can adjust your Medicare coverage. If you decide that you do not want to enroll in Medicare when you're initially eligible and you don't meet any of the certain conditions that would qualify you for a special enrollment period, you may accrue a late enrollment penalty when you do finally enroll. So if you have to buy Part A because you don't qualify for premium-free coverage and you didn't do so when you were initially eligible, your monthly premium will go up 10% for double the number of years that you did not have Part A. So for example, if you were eligible for Part A for 3 years, but you did not enroll, then you will have to pay a higher premium for a total of 6 years. If you did not enroll in Medicare Part B during your initial enrollment period, your penalty will increase by 10% for each full year you continue to go without Part B coverage. And that penalty lasts as long as you have Medicare Part B. So, for example, if your initial enrollment period ended December 2021, but you didn't enroll until March 2024, you went a full 2 years without Part B coverage. So your Part B premium penalty is 20% of the standard premium. So you will pay the standard premium, and in addition, you will also pay 20% on top of that for the entirety of when you have Medicare coverage. For Part D, there could also be a penalty for not signing up or not having creditable coverage. So if there's a period of 63 days or more after your initial enrollment period that you don't have a Part D plan or some other type of creditable drug coverage, then you will potentially be subject to a penalty. And the cost of that penalty depends on how long you go without Part D or another type of drug coverage. And that will also last as long as you have Medicare drug coverage. And that penalty is calculated by 1% of the national base beneficiary premium. So basically, they average out the cost of the premium for all the plans that are available to Medicare beneficiaries across the nation. And then you will have to pay an additional 1% over top of that. So that changes year by year, and that also affects the penalty amount that you pay. So going a little bit into different coverage types. I wanted to highlight a few things to consider while you're looking at, Medicare Advantage versus Original Medicare and which might be right for you. Original Medicare does not require any type of pre-authorization or pre-approval before getting services, but Medicare Advantage plans do require that. Medicare Advantage plans, as I mentioned, operate much like a commercial plan, and a lot of care and services can get hung up in that pre-approval or pre-certification process, and that can tend to delay care at times. Most providers accept Medicare, so likely you will not have a hard time finding a specialized provider, where Medicare Advantage plans often have a smaller network of providers, so you may have a little bit more of a difficult time finding someone for specialized care that's needed. Original Medicare does not have an out-of-pocket maximum, meaning there's no cap on what you can spend for health services in a year. Medicare Advantage plans do offer that. As well, Original Medicare does not have any coverage for hearing, dental, or vision services, whereas Medicare Advantage plans often include those services. I just wanted to highlight some tips to consider when you're looking at plans and deciding what's right for you. It's just a good idea in general to make sure you understand what the plan will cost you, including premiums, deductibles, and other out-of-pocket costs. And there could also be additional coverage rules that could affect what you pay. Make sure the plan covers the services that you need. All Medicare plans cover services that Original Medicare covers, but some plans, as I mentioned, like the Medicare Advantage plans, can offer extra benefits. Make sure your current providers or facilities accept the plan you choose. So if you choose Original Medicare, as I mentioned, you can go to any provider or facility that accepts Medicare. If you choose an Advantage plan, you are often tied to a network of providers that you need to choose from. They have set providers that contract with the plan. And you may sometimes have out-of-network benefits that allow you to receive services outside of that network. although you will likely pay a lot more for services in that case. It's a good idea to check the plan's drug formulary to see if coverage is offered for your current prescriptions. Drug formularies can vary by plan, so all plans have to offer that standard level of coverage set by Medicare, as we discussed, but really it's dependent on what policy you choose. And you want to make sure that you take the necessary time when you are choosing your Medicare plan to really understand what's available to you and what's going to fit your health needs. There is a great tool on Medicare.gov that allows you to compare plans and the coverage that's offered in your area. It allows you to search by providers in each network, or as well as to check for current prescriptions that are covered. And it offers a search for Medicare Part D and Medigap plans, as well as Medicare Advantage. So once you've signed up for Medicare, your Medicare card will be mailed to you in your welcome packet. And you can also log in or create your secure Medicare account to print your Medicare card. Your card has a Medicare number on it that is unique to you. It's not your Social Security number. That used to be the way that Medicare ran, but they've changed that in recent years just to protect the identity of Medicare beneficiaries. The card is often referred to as your red, white, and blue card. And on it is, again, your Medicare number, the date your coverage began, and if you have Medicare Part A and Medicare Part B. And those are listed as hospital and medical. If you're enrolled in Original Medicare, you need to carry your Medicare card with you at all times and provide it to any doctor, treatment facility, or healthcare provider that you're seeing. As well, if you have Medicare Part D or any other supplemental insurance, it's a good idea to carry that plan card with you as well. And this is true if you have not only a Medigap plan, but if you or your spouse are still working and you are covered by employer-based insurance as well. If you're enrolled in a Medicare Advantage plan, you will not use your Medicare card, but you will use your Medicare Advantage card that they provide to you when you sign up. You should definitely still keep your red, white, and blue card safe at your house. If you ever decide you want to switch coverage, you'll have that card already. If you are not sure if a test or item or service is covered by Medicare, they offer a really nice search tool on Medicare.gov that you can use to look up coverage, or you can also call Medicare at 1-800-Medicare to check as well. And while Medicare covers most healthcare services, they do not cover everything. And in order to receive services, you will pay for them out of pocket, or you might need to have some other type of insurance coverage if you want to receive them. Some services that are not covered include long-term care or custodial care, most dental care, dentures, eye exams to prescribe eyeglasses, any kind of cosmetic surgery, acupuncture, hearing aids, or routine foot care. And as we just talked about, you can use the Medicare website to look and see if your item, test, or service is covered. And you can also talk to your healthcare provider about the services you need and if they are covered by Medicare. Usually, if your provider recommends a service or treatment that's normally covered by Medicare, but they, for some circumstance, feel like it might be covered, it might not be covered in your situation, you will have to sign what's called an Advanced Beneficiary Notice of Non-Coverage, also called an ABN. And that ABN means that you will pay for the service if Medicare decides not to pay for it. You need to also double check if your doctor or healthcare provider accepts Medicare before you receive treatment. You should do this before you buy the coverage, But again, some circumstances change, so it's always a good idea to just check this periodically. And if you have original Medicare, before you get any kind of services, ask your healthcare provider if they charge the Medicare approved amount. If they do, you will not be billed for more than the standard Medicare deductible and coinsurance, so you end up paying less out of pocket. And if they don't, they can charge you more than the approved Medicare amount for that service, and they may require you to pay that upfront at the time of the service. If you have a Medicare Advantage plan, you can always call that plan to see if they have a network and if that provider is in network. Some plans, like I mentioned, allow you to go out of network, but generally in those cases, it's going to be a lot more expensive and it's going to require you to pay a lot more out of pocket. You can also get emergency care always, or urgent care if you need it, even if the doctor or hospital is not in network. Just be sure to notify your Advantage plan that you have gone out of network as soon as you can so that they can start any kind of background work they need to do to get that covered for you. If you have Part D, check with your plan to find out what pharmacies are in your area that are in network. You normally are able to look that up online or just by calling the plan. In-network pharmacies are often called preferred, and normally you're going to get the lowest price there for medications that you're taking. But if you use an out-of-network pharmacy, you're probably going to have to pay the full cost of the medication. If you need assistance paying for Medicare, there are some programs that may be available to you. The eligibility for these programs is based off of household income and resources. The first is the Qualified Medicare Beneficiary Program that pays for Part A premiums, Part B premiums, and any deductibles, coinsurance, or copayments that you may have. The next is the Specified Low Income Medicare Beneficiary Program, also called SLMB or SLIM-B, some people call it. That helps cover Part B premiums. The Qualified Individual Program, or QI, also helps pay Part B premiums, but that program is run a little bit differently. And lastly, the Qualified Disabled and Working Individuals Program helps pay for Part A premiums if you are a working disabled person or if you lose SSDI and premium-free Part A when you return to work. Just as we've discussed, it's a good idea to view plan options side by side. You need to decide which plans are going to be best for you. And it's a good idea not just to consider the premium when you're looking at the cost of a plan. You'll want to find out that information, because if you can afford to pay a higher premium, you'll likely have a lower deductible and lower out-of-pocket expenses. So you may be able to pay a lower, while you may be able to pay a lower premium, you often have higher deductible and higher out-of-pocket expenses through the year. As we've discussed, when you're looking at plans, be sure to look at your preferred providers. That includes doctors, specialists, hospitals, and pharmacies. Make sure the routine care that you are having, including medications, are covered. And it's also a good idea to think about care you anticipate needing in the next 12 months and check how that care is covered as well. Talk with your care team, talk with your providers. It's such a big decision, and it's a good idea to have those who are managing your care to weigh in on what they feel is best for you as well. You enroll in a plan, it's a great idea to get together a list of current treatments and medications. It's the best place, as we've talked about, to shop for Medicare coverage is on Medicare.gov, because it's just so easy to compare and search for plans. And if you already have a Medicare Advantage plan and you're looking to continue that coverage into the next year, it's such a good idea to review any of the information that was sent to you by your plan for the upcoming year, just so you can make sure that they didn't make any big changes to coverage or formularies or anything like that. If you're unsure about enrollment or you're becoming overwhelmed with all the options available to you, you do have some options for guidance with the process. The first is the State Health Insurance Assistance Program, also called SHIP. This program gives one-on-one advice and assistance to Medicare beneficiaries and their caregivers and families. They are trained, it is free, it is a great resource to help you navigate Medicare, navigate enrollment, and they can really help you kind of break down what your options are. As well, since these are complex programs, lots of parts and pieces, PAF and the ALS Association have teamed up to offer the ALS Insurance and Benefits Resource Line. This line provides free direct telephone access to insurance and benefits experts who can help with navigating eligibility and enrollment in disability benefits, overcoming insurance coverage and financial burdens that might impact your ability to get the care that you need. And some additional materials on the topic of Medicare that can walk you through. I know that with time constraints, we've really only been able to provide kind of a high level overview. There's a lot more to Medicare and a lot more specific to ALS that we didn't really get to discuss. So we do have a 7-module Medicare training series if you want to review that and learn more. We have an award-winning guide about Medicare that was just released last year called Making the Most of Your Medicare Benefits, a guide to navigating Medicare with confidence. We also have, there's an open enrollment publication. There's a step-by-step guide to choosing a Medicare plan. And then, as I mentioned, you can also reach out to us at patientadvocate.org if you have questions about your specific situation and get a free case manager through that benefits line. So thanks for listening. I hope you learned a little bit more about Medicare, and we're ready to take questions.
Emily, thank you. I know it's a ton of information, and so we'll tackle some questions, but what's great to know is that the Patient Advocate Foundation is there to help as our local state health insurance counselors. Before we tackle questions, Emily, I wonder if you want to go back one screen and leave your resources up for folks.
Sure.
And then as a reminder, you don't have to scribble it down. These slides will be available in a few days on our website. So let's get started with questions. I'm going to start at the beginning. How are Medigap plans worth the very expensive monthly fees?
That's a great question. Yes, Medigap plans are not cheap, but they do provide some security. As I mentioned, when you have original Medicare, there are no out-of-pocket maximums. So there's no kind of tip top for what you could potentially pay in a year for services. So if you have a ton of healthcare services or you're in the hospital for a long time, that can really, really add up. So a lot of people like the Medigap plans because they do offer, just a little extra layer of protection if you are in a financial position to be able to purchase them. I will say, if you are getting a ton of medical services, say from a hospital, you can always reach out to the hospital to see if there's any kind of financial assistance available. A lot of hospitals provide financial assistance programs or discounts to patients who struggling to pay for care. So that's always another option. If a Medigap plan is not in the cards financially, then I suggest reaching out to any kind of provider that you are receiving care from and asking if they have a financial aid program that you can apply for that could help reduce some of those costs.
Okay, thank you. And we got a request to go back one more slide, I think. Let's
Sure.
see if there's, if that's the right one. Okay, I think that's the one. So a really interesting question, and I know this pertains to, I think 13 states. Philip asked, because he's living in South Carolina, I take it, if you're under 65, a Medicare supplemental program is not an option. And S chip is $1,600 a month. Is there another option? And I understand that there are about 13 states that don't offer people under 65 a Medicare supplemental plan.
Correct. That is true and also unfortunate. So there is some legislation kind of floating around to hopefully combat that situation. My best advice is to reach out to your insurance commissioner to see if there are any other options in your state. It's hard for me to know specifically, what are options in your state, but I think it's a good idea to reach out to the commissioner of insurance in South Carolina to see if they have any ideas about what options may be available to you there.
Yeah, and certainly we can help you get some advocacy information at the ALS Association. I know there was some really great advocacy work done recently in one state that did get a bill passed to offer that. I think it was Kentucky, but I'm not sure. So let us know if you want more information on advocacy. Here's a question that has to do with the working time frame and being eligible for Medicare that you talked about.
Mhm.
I only started working again in 2021, then diagnosed in 2023. Do I have any chance of qualifying? Had worked previously for 12 years continuously 20 years ago as a teacher paying into Medicare.
So I'm not sure if you're talking about qualifying for disability or qualifying for Medicare. But I will say normally the look back period for disability is 10 years. So if you have worked 5 out of the last 10 years, then you would have an eligibility to apply. It goes based on work credits. So the Social Security Administration splits the year into 4 work credits, and each quarter that you work gets you a credit. And so when they do the math to determine whether or not you're eligible to apply for Social Security disability, they look at how many work credits you've had in that time period to determine your eligibility. So I hope
And,
that answered that.
and if it doesn't, because I know it's incredibly complicated, who would be the best person? Is there someone locally that would be able to help advocate for someone?
Absolutely. So it's a great idea to reach out to your state health insurance assistance program. They are going to be the experts um, on eligibility and on any specific things that are going on in your state. Every state has one of those. It's free. They're all trained to help with navigation, to help with enrollment, to help with kind of reviewing your options as well. So I think that would probably be a good place to start. Again, you could also reach out to the ALS Insurance and Benefits Resource Line, and we can have someone from Patient Advocate Foundation who can go over your eligibility with you as well. But that's a good place to start. Or you can contact Social Security because they can kind of review that for you as well.
Okay. Tamara, you put a note in here that it looks like Thomas has a question. Do you want to see if he still has a question he wants to ask?
It looks like he just put his hand back down.
Okay, maybe we got to his question. I'm not sure. I want to just be sure to point out, because someone reminded us about healthwellfoundation.org. They they often have help with ALS specific medications. And so if folks are looking at, I think, co-insurance questions or even coverage in general for ALS medications, do go to healthwellfoundation.org for more support.
Absolutely,
Okay,
they are
I
a
see
great
that
resource.
Thomas put his question in the chat. I have drug coverage from a work health insurance plan. The formularies are similar. Is it beneficial to get Part D also? Like, do they stack or do they just overlay each other? Great question.
That is a wonderful question. So I would speak with your works administrator for your health coverage. Sometimes there's some sticky situations, and I would hate for you to get into a circumstance where any of your benefits are voided. So I would check and see how they handle having multiple coverages for prescriptions. I think that would probably be my first stop, is reaching out to your HR department or the administrator of your plan, because sometimes you're not able to have both. So that would be my first stop.
Okay, great. Thomas says, thank you. A few other resources that were mentioned besides HealthWell is Chronic Disease Fund, Rare Disease Fund, and Christopher Reeves all have ALS funding for prescription drugs. Somebody shared. Thank you, Sherry. Joseph asked a really great question. I currently have an Advantage plan. Can I just drop it and go back to original Medicare?
Yes. That's a great question. So there are some specific times throughout the year that you can do that. It's, as I mentioned, I don't know if you caught my comment, but there are multiple different times throughout the year where Medicare has open enrollment type times. Sorry if that didn't make sense, but Medicare has several different open enrollments throughout the year.
Right.
And there are specific circumstances where if you have an Advantage plan, you can change it. So you can do that during open enrollment, which is it's October 7th, October 15th to December 7th. So you can do that, and that coverage will start January 1st of the following year. Or there is a specific time for Medicare Advantage plan open enrollment. The Medicare open enrollment system is incredibly confusing and complicated. It is one of my least favorite things about Medicare. However, there is some legislation floating around, hopefully will be approved, that will streamline the open enrollment process and make things a lot easier, so it's not this fragmented system of, oh, I can do certain things throughout the year and not at other times. It just gets really convoluted and confusing. But all that to say, you can go back to original Medicare if you have an Advantage plan. I would just make sure that you do it during an approved time. I would suggest during open enrollment in between October and December. Sorry for that long answer, but yes, you can drop it.
Just make sure you've got something to cover you. There's some other interesting questions about stopping payment on things. Let me find the one. Someone is interested in. So I recently got Part A and also Part B. I am covered under my spouse's insurance and met the deductible for this year. Can I drop Part B now to save the premium money for the rest of the year and pick it up again during open enrollment to help cover large deductibles? Technically, I want to keep both Part B and insurance from my spouse's work.
Oh gosh. I would love to speak with you or have one of our case managers speak with you. It's hard to know without some additional specifics to your situation how to advise you. So please reach out to me directly. My email is Emily, EMILY brown@patientadvocate.org. I'd love to get a little bit more information from you to be able to answer that accurately.
Great, thank you. And I know we're running out of time, but so many questions. Is there a way to qualify for long-term care in a facility or at home through Medicare?
Unfortunately, no. Medicare does not offer any kind of long-term care benefits. That is one of the unfortunate parts. But I will say commercial insurance also does not cover long-term care insurance. So it's a difficult situation. Medicare will only cover 100 days in a skilled nursing facility. And then it's up to you to kind of provide the rest of that coverage. If that is something that you see in the future, I recommend looking into Medicaid. Medicaid is coverage for low-income people or people in other circumstances who that they do cover long-term care. So I would check into what your Medicaid options are in your state and see if you qualify for any of that, because that would be a way to get coverage for long-term care services.
Great, and I think that that might apply to this question. I want to get to this just because it sounds like they're really struggling. So my brother has ALS. He receives Medicare and an Aetna supplemental insurance. What's the difference between regular Medicare and SSDI? He's financially struggling. So what's the maximum benefit he can receive from other resources?
So I'm trying to understand your question. So there are no differences between Medicare that you would get if you qualify by age versus Medicare that you would get if you qualify by having a disability. It's the same coverage. All it has to do with is what makes you eligible for the program. So I would recommend looking into one of those programs that I mentioned. Either, actually, I'll just slide back a little bit so that you can see that slide. One of these financial assistance programs that Medicare provides, either the qualified Medicare beneficiary program, all these programs help pay for Medicare costs. So if you are thinking maybe that this might help, reach out to the Department of Social Services in your state or in your area, or the Medicaid office in your state. That is who administers these programs, is the Medicaid program in your state. So I think that would probably be a good place to start.
Yeah, and if folks aren't sure where to go to apply for some of these state-funded programs, I would say touch base with your local care services, your ALS Association Care Services team. I'm sure that they can get you in touch with your SHIP counselors or folks to help you find things that you might be eligible for. When folks are financially struggling, we want to get them absolutely everything that they're eligible for. So I know there are many questions we didn't get to, and I'm sorry about that. We always run out of time, but Emily, thank you. Folks were really interested in having you come back and help us again to understand at least where to go for some of our questions. And so definitely work with your clinic teams to understand what you're going to need so that you can then get the Medicare program that's going to best serve you. And then call us here at the association or call the Patient Advocacy Foundation for, if we don't have the answers, we can at least help you find the people who will have the answers. And one last plug for Patient Advocacy Foundation. I remember at ALS Nexus, one of the presenters, I think you said maybe he's your CEO, talked about some incredible advocacy work that you folks do when people get denials that shouldn't have been denied. They will work hard and advocate for folks. So lots of reasons to be in touch with the Patient Advocate Foundation. Thanks for those of you who stuck with us. Please reach out at, when we can help. Emily, thank you again for joining us. Before we wrap up, I just wanted to share next month's really interesting topic. We have 3 presenters coming to us from the National Center on Health, Physical Activity, and Disability. They have a program focused on mindfulness, exercise, and nutrition to optimize resilience, a topic that we've talked about before. They've modified their program a bit to serve folks living with ALS. So they're going to join us next month. They're going to give us a bit of a taste, really, of what their 8-week program is like. It's a free program, again, to help folks focus on things like nutrition, exercise, and mindfulness to live better. So that's coming on August 26th. But for today, let's wrap up. Thank Emily again for joining us. Thank you all for joining us again. And please take a few minutes to answer our 3-question survey and include your email if you have questions specifically needing a response. Have a great day. Thanks, everybody.